Good afternoon, everyone. Thank you for dialing in. This is the Mental Health at Work 2019 report webinar, Time to Take Ownership, in partnership with Mercer Marsh Benefits and the Business in the Community Wellbeing Leadership Team. I'm your facilitator for the next hour. I'm Nish, and I'm the Business Director for the Campaign and Content team at Business in the Community. My role is really to have oversight of all of our wellbeing and inclusion campaigns, get us working to better and be more impactful to our membership. And I'm delighted to welcome our speakers for the webinar today, Louise Aston, our Wellbeing Director at Business in the Community, and Dr. Wolfgang Seidel, Workplace Health Consulting Leader UK and Europe at Mercer. Louise and Wolfgang, can I ask you both just to introduce yourselves slightly?
Hi everyone, I'm Louise. I'm Wellbeing Director at Business in the Community. I actually started my career as a textile designer for fashion and was a fashion buyer at M&S. There is a kind of logical sequence to my career. Is I transitioned into campaigning by taking health into fashion by designing a collection of sun-safe swimwear for kids. And basically then got into mental health campaigning when my brother was diagnosed with schizophrenia, and delighted to be working at BITC in terms of positioning health and wellbeing as strategic boardroom issues linked to achieving business objectives. Our approach is very preventative. It's about taking a proactive approach to health and well-being. We take a whole person approach, which is about looking at the inextricable link between physical, mental, financial and social health and well-being, along with a whole organisation approach. Basically, in terms of where we're trying to go with our wellbeing campaign, it is this whole person approach, but we do have a special focus on mental health, because we know there's still a long way to go, and that's why we actually produced the Mental Health at Work report.
Fantastic. Hello everybody, thank you for joining. My name is Wolfgang Seidel. Just to get you used to my accent, I always put on an Austrian accent when I talk about psychiatry. And I am a psychiatrist by background and work for Mercer, running a health strategy practice called Workplace Health Consulting, where we are advising companies on health and well-being strategy, integrated healthcare programs, absence management, and proactive interventions such as resilience programs. By background as well, just to echo Louise's biography to some degree here, I studied medicine and then psychiatry, philosophy, and sociology, and also did ROI studies at business school in case those questions are coming up. I'm really delighted to be here today. Thank you for joining.
Thank you both. Just to run through the content for the webinar, and this webinar is hot off the press, so we actually launched the report yesterday, so a real opportunity to hear hot off the press the findings. And so the crux of the content for the webinar is really talking you through the main findings of the Mental Health at Work report. We've got a fantastic video of some case studies to really hear from individuals that have experienced mental health and how they've been supported in the workplace. And then just really breaking the webinar through various subject headings, including breaking the stigma, positive progress, the causes of mental health at work, key concerns, and the call to actions that we're making today on behalf of the report to business. There will be some opportunities for questions at the end. So for about 40 minutes, we'll be delivering the content from Wolfgang and from Lou, and then opportunities for about 20 minutes at the end to ask questions. So have a think, and then I'll check in and collect those questions and open them to the panel in about 40 minutes' time. So Louise, over to you.
So yeah, delighted to share the findings of our 4th annual Mental Health at Work report. We just had our launch yesterday. We were on breakfast TV. We've had a lot of interest. And while this is our kind of 4th national mental health at work report, we have seen some positive progress over the last year. And I think what's really special about our report is primarily we're looking at mental health through a line manager lens, but we're also, it's a very rich report because we're also looking at mental health through a number of intersectional lenses, including age, gender, race, LGBT+, and also we have financial well-being, which is kind of baked into the whole report. As you heard me say earlier, financial well-being is a key strand of holistic well-being. And for this year, we've actually introduced a new spotlight on bullying and harassment. So as I said, we've seen slow incremental progress, but it just isn't fast enough. It actually shows that businesses really need to create a culture of psychological safety, accountability and transparency where all employees feel supported and can be open about their mental health. So in terms of giving you some of the context is business in the community, we're all about collaboration, and we have a network of hundreds of members, but we also work with a lot of external stakeholders. So basically, YouGov were our national survey partner. We are headline sponsor with Mercer Marsh Benefits, who are also a member of our wellbeing leadership team. You'll see the logos of our leadership team is these exec members basically provide overall direction for the campaign in partnership with business and the community. But for this particular, our mental health focus is we've worked with 9 national partners, including Mind, CIPD, Mental Health at Work. And why this is really significant is actually working with 9 national partners who in their own special ways are trying to improve mental health at work, is we've actually got a complete consensus over our 3 calls to action, which are supported by 6 stretch recommendations for leaders. So basically all 9 partners are actively supporting that. You're going to hear a lot more about what we're doing in the next year as we have an extensive dissemination program. And in terms of walking the talk, I'm really delighted that actually while we were developing this report, is we felt it was incredibly important to actually introduce a real human element. So we put a call out to our leadership team and asked them if basically they could introduce us to some of their colleagues who would actually talk to us about their mental health experiences. So this is a kind of compilation of about 11 different stories. It lasts about 5 or 6 minutes, but in terms of enlightened employees, where it is okay not to be okay, where the stigma is being reduced by it being okay to talk to your line manager and receive support. Thank you.
I don't actually think I realised I was taking on too much until it was too late. The working day extended to the working evening, to extended to the working weekend, and like you say, that became the norm. I was literally the hamster in the wheel, running faster and faster just to keep up. Because I was taking on more and more, I was having to work harder and harder. My husband will talk about a 4 o'clock in the morning conversation where I said, I simply can't do it anymore. I'm done.
My panic attacks appeared over a period of months at the end of last year, and they were always the same: a feeling of nausea and then hot flushes, and then it would just start to build in terms of my heart rate, and that would race and race.
My father passed away and my brother passed away in the same week, so there was only 4 days in between that. Finding that I was at work going sitting in a box room after work, nobody to talk to. Didn't realise at the time obviously the effect, but as time went on, just found that I couldn't go out of bed anymore, couldn't engage in a conversation. It was just like I was a totally different person, and I just couldn't seem to shake it off.
I've always had sort of issues with anxiety, but it's always been around busy times in my life. I just thought it was me not handling everyday stresses very well, and if I made a mistake, a tiny little mistake that everyone's like, whatever, get over it, but it would be there in the front of my mind and I couldn't get past it. That feeling like you're constantly in fight or flight mode, constantly aware of everything that's going on, thinking about things, well, if I do this, if I do that, it was just consuming my brain and I couldn't do anything else.
When I was a teenager, I was more aware of probably being more emotional at that time. At different times, there'd be a good week or two where I just feel what I now recognise as being low, or back then I would have just thought of as not being in a particularly good mood, I imagine. It's probably there in the back of your mind that maybe that's something maybe that's something more than that. I think I was very scared of how it would be perceived by other people around me, at work, family, friends, it being perceived as a weakness. And I remember very much actually that going to the doctors, and after that it became something very different. It became very empowering to take control of the narrative. I think the most important thing is that you create a culture where talking about mental health and mental well-being is acceptable, and part of what you do. What we try to do at Santander is first and foremost we talk about people having mental well-being, as mental well-being being something that everybody has and manages on a day-to-day basis. It's getting away from this idea that a mental health condition is something that you either have or you don't. It's opening the club up to everybody and saying this is something that we can all talk about and we can all make improvements on.
Blurted it out, as it were, at the time, just blurted out and said, I've German and I've got depression. I think it was a bit overwhelming at the time, but the support I got straight away from everybody coming and speaking to me about it was fantastic.
By talking about my experience to other people, I can talk about the signs and signals, and so I will speak to them about the signs to look out for, and we do that with each other, so it's not just me telling other people what to look out for. For me, it's reciprocal. Being aware of that creep with the extension of the working day and the weekend, especially as I'm a flexible worker, so I have young children, really is that self-awareness. And in my head I have almost an image of a cliff edge, because I don't want to fall off that cliff edge again. And I challenge myself as to how close am I, and if I am getting close to that, what am I going to do to rein it back in, to do something positive.
It's been an amazing change for me. If you can imagine, you're sitting there reading a book on a Sunday afternoon, and you read and read and read, and then suddenly someone comes in and switches a light on and says, why are you reading in the dark? Well, you haven't noticed that it's got dark because you've been in that situation. And I looked back kind of at the end of my therapy sessions and thought, God, I don't even recognise the person that I was 6 months ago. And not to say that I don't still have anxious times and anxious days. What I've learned is that, I do have anxiety. So I recognise that and I live with that and I manage that through mindfulness and exercise and a different outlook on life.
I am so lucky with the team that I've got at the moment. They've been so supportive.
Listen to the employee as much as you can, check in on them to make sure they're okay. You don't have to check in all the time, I keep on the case, they do need a bit of space, but just monitor from a distance. Sometimes you don't need to do anything, it's just having that conversation, just asking whether that employee is okay.
It was just enough to know that actually I'm not on my own and there are people that I can talk to. I've been really lucky, although it's been a really tough time. It's really sort of shown me that actually I've got some really good friends in work. All I can say to Lee is thank you. He went from being my colleague to my manager, which is not an easy task. He's made it so much easier, and I don't think he realises how much easier he has made it.
She's helped me develop myself as a manager, because she's been so open and honest. It's really empowering to know that I've managed to help Rachel through this and make a difference to her.
We normally do that when we've been on a team night out though, don't we?
Well, I hope you could all see those videos. I saw some frantic communication between our technician and some of the listeners who were not able to get the whole story. So apologies for that from us. But for those of you who have seen it, they are great examples of companies breaking down the stigma of mental health and empowering their colleagues to speak out and get help. So before I will now sort of bombard you with statistics, let's just use this slide here for a reflection about stigma and mental health. There is a culture change is needed, and to be fair, we have come a long way with the Princes William and Harry speaking out publicly, and celebrities and CEOs talking about their own experience. So why is mental health still taboo? People don't want to talk about their mental health because first there is still a fundamental issue with the way we talk about it. If someone is sick with influenza, we say they have flu, never they are flu. The implication is that this is something from which they can recover. Yet if someone is sick with depression, we say they are depressed, as if this now defines them entirely. It would be far better to say they have depression with the implication that there is a clear treatment pathway in place. So if someone has a physical problem, such as back pain issues, there's a clearly defined care pathway featuring a physical assessment, recommended adjustments and support to put these into practice. But most organizations lack clear mental health pathways that the manager can use to direct people towards appropriate support. Instead, they typically have a range of disjointed tactical initiatives, such as one-off mental health days or work-life balance classes. The result is that most managers have no idea what to do with someone struggling with a mental health issue. So manager training really is another key route to helping this problem. And now, actually really starting to share some statistics and insights with you from the report, I would like to draw your attention to the fact that it is 62% of employees who have experienced mental health issues sometime during their career. And 30% of those, as you can see on the slide in front of you, were diagnosed with a mental health condition by a professional. Yet the majority of employees experiencing these symptoms shy away from talking to their line manager. And I would say for good reasons, perhaps, since managers tell us, again in the survey, that they haven't been trained enough in this type of conversation, and they often had to put organizational needs before the well-being needs of their team. Hence, in conversations like the ones today, we tend to lament the state of affairs in mental health. However, Louise and I are really delighted today to report to you what a privilege it was to conduct those interviews that you have seen in the videos, and to share with you the warmth and competency that came across from line managers and employees telling me about their mental distress and solutions implemented, which should fill us all with immense optimism and reassurance. These conversations, like the conversation between the line manager and the employee that you saw, reminded me actually why I became a psychiatrist and a counselor in the first place. I'm not denying that the figures that clearly evidence a mental health epidemic are startling. But I have also seen the evidence of good common sense and humanity, unencumbered by complicated psychological theories that we can all learn from. Shining examples of good practice of empathy and careful management are the basis for good training and learning for managers who are less experienced and less gifted in handling stress at work. So the key words to take away here on a positive note are empathy and humanity. And by the way, empathy can be learned. I get a lot of questions on that, but we could probably talk about this later. You can train managers in empathy.
Even David Brent?
Even David Brent, perhaps, yes. If you have a good sense of humor, as all Austrian people have, you get away with it. So there is positive progress, and that's where we would like to get that as well today. And so you see now a flood of more statistics in front of you. But they are encouraging statistics. The number of employees experiencing mental health issues who report that no positive action has been taken has gone down, as you can see here. Similarly, the destructive practice of avoiding to deal with the issue by simply dismissing, demoting, or disciplining employees who have mental health issues has also decreased. Not decreased enough, but it is decreasing. The data of this report makes it absolutely clear that no organization will succeed with a sustainable business by dismissing a large proportion of their highly skilled employees. Because everyone has mental health, and assuming issues won't occur in your organization is a fallacy.
So the report also looked at basically the causes of poor mental health. And actually what came as a big, well, not a total surprise, but it just confirmed the sort of trend from last year, is that 2 in 5, or 39% of employees, have experienced poor mental health where work was a contributory factor in the last year. And if you break that down a little more, that is 1 in 4 in the last month, or it's 6 in 10 in a person's lifetime. You know, when you think about that, we know there's loads of research to support that good work is good for physical and mental health. But obviously what we're seeing here is bad work can be the cause of poor mental health. So in terms of the title of this report about taking ownership, this is really linked with creating good work that employers can actually own, and actually being aspirational about designing good work that enhances mental health. Having said that, is 50% of employers have cited poor mental health due to causes outside of work, and those causes aren't often or always acknowledged, but we'll come back to that. So in terms of the work-related poor mental health, where work was a contributory factor, is over half of the people who took part in the survey, which I need to add was a statistical representative sample of the whole nation. It was due to pressure or conflicting priorities, more so than actually workload, so that was 36%. But as I said, for the first time, we included a spotlight on bullying and harassment, and this is a shocking figure. You know, nearly a quarter of people cited bullying and harassment from their manager as a cause of work-related poor mental health. You know, that isn't acceptable. People should be able to actually call out bad behaviours. There should be clear policies, but this definitely isn't acceptable at all.
This is an interesting slide as well, because it speaks to the balance that Louise just mentioned about stressors in work and stressors from outside work. And some commentators often assume that issues outside work have no impact on the workplace at all, which is obviously not the case, as we are not compartmentalized human beings, but people bring their whole self to work. In most surveys and EAP statistics, we find a huge prevalence of relationship issues in work or out of work, or the lack of social well-being in the form of loneliness, as you can see the startling figure here, which affects young employees disproportionately more than older employees. So let's not forget that the positive message here, though, is that work can have a very beneficial effect on people's well-being. Just think about combating loneliness as well, as long as it's good work, which we write a lot about in the report, and Louise has mentioned before as well. And at the same time, when we talk about this dichotomy about work and home life, I think the simplest happiness equation is being able to work and being able to love. That's a statement that goes back to Sigmund Freud. And I think it is a better way of looking at work-life balance than simply getting your calculator out and trying to calculate exactly in a sort of stressful way how much should be in work and how much should be outside of work. So if we sort of drill down a bit more on the key concerns that we are seeing here in this report, I would say dealing with mental health issues at work is not rocket science. So we just need to break the figures down and let's get to work and identify some of the root causes of the distress, such as what I call minority stress, and pay attention to the lack of inclusiveness in some workplaces. For instance, the prevalence of distress in the LGBT community is nearly 20% higher. Also, women experience harassment and discrimination, as the Me Too movement has revealed and which is also borne out in the data of this report. BAME employees suffer abuse at an intolerable level. Nearly a third experience negative behavior due to their ethnicity. Again, you see that in front of you on the slide. However, trying to again call for action and finishing this slide on a positive note, I would say that research generally and unequivocally explains to us that diverse teams are much better at problem solving and are much more productive. So that's the takeaway point from this slide here.
So before we get to the calls to action, I just really like to urge you to actually check out the full report. We will be sharing the URL at the end of this session. The whole report has got some amazing expert commentary from our 9 expert partners like Paul Farmer, like Piece Cheese. We've got an amazing collection of really, really progressive case studies. We give a lot more detailed information around drilling into those multi-intersectional lenses of age, gender, race, and more info around financial well-being and bullying and harassment. So please do look at the full report because it's really worth it. Next slide. Oh, no, sorry, back. So in terms of actually coming up with 3 calls to action for all employers, this is what business in the community, with a consensus from our 9 national partners, our leadership team, came up with. And you've heard about how good work is a real enhancement of mental health. But although we've seen the horrific kind of 39%, 2 in 5 of employees who actually develop mental health issues due to work, conversely, this is a massive opportunity for all employers to create good work that really enhances mental health for everyone. If we kind of got beyond the tactical things like a bit of training, as Wolfgang was talking about, you know, an EAP, a nice policy in place, it's really tackling the systemic causes of poor mental health. It's an opportunity. We've seen from the research that 50% of mental health issues are caused from issues from outside of the workplace. So it's really important that employers actually acknowledge that their people will be experiencing issues like relationship breakups, basically deaths, bereavement, and actually acknowledge that they've got support in place to actually support people. And there is a bit in the report about domestic abuse, and domestic abuse is a great example of a domestic issue, which also collides with the workplace. So some of these things don't even fit into neat boxes. And then the third call to action, which again aligns with the Stevenson Pharma enhanced standards, the real importance of publicly reporting on your well-being performance. Why is this important? Is obviously business in the community. We are a responsible business movement. This is about actually reporting on sustainable human capital management, that we're not just burning people out and throwing them on the heap. It's also about accountability and transparency, and we know from the findings of our survey that senior leaders, CEOs, actually are out of touch with the reality of what's really going on the ground, in terms of thinking they're doing way better than they are. So what gets measured gets managed. So again, at very least, mental health should be appearing on your management scorecard, and actually taking it one step further and publicly reporting, but looking at the leading indicators as well as the lagging indicators. And certainly this is something that the investment community are becoming more interested in. So just quickly, underneath the 3 calls to action, there are 6 recommendations for leaders. Each of the 6 recommendations are supported by 3 actions. And as I said to you, this was formed with a consensus from our 9 partners and our leadership team. And each of the recommendations is basically kind of starts with a principle. So as we said, and why this report's called Owning, it's all about ownership, is about, owning responsible leadership. It's actually recognizing that mental health is a critical component to being a responsible business, and how important that leadership in terms of consciously role modeling behaviors that promote good mental health. We've heard from Wolfgang about the importance of a really respectful and inclusive culture, but it's also about how we have a really coherent system that embeds management accountability and operational policies into the DNA of the organization. In terms of understanding the impact of work, is actually, this is aspirational. We've talked about good work being good for well-being. So you need to actually understand the impact that work is already having on people, but thinking about this parity of esteem in terms of physical and mental health, and manage the risks of mental health in terms of, say, conducting an audit in exactly the same way as you would with physical health. Next. Then equipping line managers, all of this was, obviously line managers are absolutely crucial, but it's about, in terms of that cultural shift, it's about positioning mental health as business as usual for managers. It's about starting a culture which starts all meetings with asking people how they really are and really meaning it. It's about embedding the promotion of good mental health as a core competency for managers and assessing them on it, so making them accountable. And again, something that Wolfgang talked a lot about in terms of what he took away from some of those videos was, that recognition of empathy and compassion, and actually reward it accordingly. And obviously training has a big role to play here as well. And then moving on to tailored support, again, taking an inclusive employer-led approach to providing support. The importance, we saw in the Stevenson Pharma review that 300,000 employees fall out of work each year due to a mental health issue. That could have actually been prevented with a few workplace modifications or reasonable adjustments that are actually tailored and agreed in dialogue with the person who's affected. It's about building those active listening and communication skills and making signposting easy for line managers. And obviously the importance of a diverse and inclusive range of facilities and services like EAP and OC Health. And then the final 2 recommendations are around respect and inclusion. You saw about that nearly a quarter of the work-related poor mental health was caused by people being bullied and harassed by their managers. So in terms of promoting and implementing zero tolerance policies and guidelines, awareness of non-inclusive behaviours and are not okay, and define what are unacceptable. And obviously, in terms of supporting staff to be responsible bystanders if they witness any of those bad behaviours, and obviously the importance of joining up inclusion and wellbeing activity to enable a whole person approach, and the importance of tracking. We flagged financial wellbeing because it's so important, and we know it's emerging, as I said, a real key strand of holistic wellbeing. We know that there's a lot of stigma around talking about financial stress at work. So in terms of actually knowing what the state, whether there are work-related causes that could be impacting on employee financial well-being, like pay, contract type or shift patterns, so stuff that employers can own. Showing your commitment to increasing financial well-being and breaking the stigma through communications and campaigns. And then really importantly is promoting financial education. Again, this is, the focus is on prevention. And before I hand back to Nish, I just want to ask Wolfgang for any just summary closing remarks about everything we've talked about.
I think we leave that to our audience because they will ask us very, very incisive questions, and
Okay.
Let's see what happens there.
Okay.
Amazing. Thank you both very much. Okay, it's over to you. So I think we've got a couple of questions that have been posted as Louise and Wolfgang have been talking. But while we just load those up, Louise, Wolfgang, you've talked a lot about good work. How would you describe good work, Lou?
Well, there's been a lot written about good work. I mean, obviously, we've got the Matthews Taylor report on good work and how that is an opportunity for UK PLC. Is the Work Foundation have brought out some really good research around the 7 dimensions of job quality. And obviously, in terms of good work, it depends what sector you're in, what your demographics are, what kind of work is involved. But in terms of how the CIPD defines them, pay and reward is fundamental in terms of, actually getting rewarded and being paid a fair wage. In terms of your employment contract, the nature of your work, whether it actually promotes good health and well-being, the importance of work-life balance, or some people might even call it work-life integration. Relationships at work is incredibly important. Employee voice and representation, incredibly important. And of course, autonomy and control. So that's a brief outline of the components, but I would definitely go and look at CIPD's dimensions, and I'd also look on the Work Foundation's website because they've done loads of good work.
Okay, thank you, Louise. Right, we've got some questions coming in. First one, what do you think about the trend for mental health first aiders? My concern as a mental health nurse is that they are unregulated and actually I can't read that one. Anyway, Wolfgang, what do you think about
That's a very, very interesting question, so thank you very much for asking it. And it is something that I'm being asked at conferences more and more. Just a few days ago in Manchester as well, where Kerry Cooper and I were on a panel and discussed that issue as well. There is a problem with where you put your finger on it, quite rightly so, by saying it is unregulated to a degree and sometimes unsupervised. So the point here is it is an extremely helpful intervention in principle, and we want the organization to become a more caring organization and to develop ambassadors for mental health, and mental health first aiders are such first port of call for many. But like any profession has to develop over time, and this is a very new, it's not a profession per se, but you know what I'm trying to say, it has to develop its own standards. So like counselors had to learn how to go into clinical supervision to make sure that their practice is ethically and professionally up to scratch. I think there is a movement now and a trend to make sure that mental health first aiders also undergo this type of professionalization, for want of a better word, and we will have to have some oversight over what they are doing. It's also important that you are engaging and disengaging at the right point in time, because as lay colleagues, you are not supposed to take on a case for counseling, obviously, and you need to know what the referral routes are and when to hand over. And a form of clinical supervision or governance is absolutely called for. I mean, that takes us, I think, into another question as well that I have seen on screen, which talks about training per se, mental health training per se, because that is also subject to scientific review. And there are, of course, PhD projects and research projects out there to find ways of evaluating what type of training is more successful than another type of training. But as a takeaway for today, I would just say, when you talk about line manager training in general now, as opposed to just the mental health first aid training, what you want to look out for is to teach line managers at least two things successfully in experiential learning. One is to spot the early warning signs of troubled employees. And I do call it troubled rather than stressed, because some of the issues that encumber people at work have to do with harassment or bullying. That's not per se a mental health issue. It is something that is needs to be tackled by the organization systemically, as Louise was saying many, many times. Mm-hmm. And the other aspect is that once you learn how to spot those early warning signs and you have developed the right empathy skills to talk to people, again, in the wake of the mental health first aid question, I would say it's not important that you become a psychiatrist and you know all the defining characteristics of eating disorders vis-a-vis depression and anxiety disorder. You need to relate as a human being with advanced empathy skills that can be learned. And you can only put those then in practice when you also are cognizant of the referral routes that are in place. So that brings us back to the conversation about mental health pathways. You need to be able to refer people and have those referral skills. Most managers don't know what a management referral to an EAP looks like for fear of breaking confidentiality, but all those things can be done professionally and of course only with informed consent. So two things: spotting the early warning signs and having referral skills.
Yeah, and just to say about, when this is in the community, we started our journey into mental health was almost 5 years ago, is at the beginning talking about mental health first aid and promoting it to our members was really helpful in terms of actually getting them to understand the kind of parity of esteem in terms of you have physical first aiders, so you should have mental health first aiders. So that was really good shorthand in terms of people getting them to understand that. And I do think once we do have some kinds of professional standards to protect those mental health first aiders, that actually things will become a lot more professionalised. We are hearing a lot of anecdotal stories from our members about certain mental health kind of first aiders who haven't been able to, or successful at creating boundaries, and actually in terms of trying to help people who've overstepped those boundaries has been very detrimental to the mental health first aider. But I do think we'll get there. As I said, I'm really positive that it was a good thing in terms of breaking down that stigma at the beginning. The other thing I'd say about anecdotally around training is, there's a lot of kind of consultants and individuals who are really trying to jump on the bandwagon of kind of training, and there's some very unqualified outfits and individuals out there. So, basically we would definitely recommend training provided by Mind and Mental Health at Work. So just be careful who you use in terms of.
So they're good organisations.
Yeah, Mind absolutely rock solid, and Mental Health at Work. This is the organisation which is connected with Maudsley. and they're much more into about mental health literacy. It's much more upstream. But obviously, you know, if you've got in-house expertise, you can design your own.
And there's a number of other training providers, as long as it's evidence-based. So that's what is our credo today. I think we want to get across that one has to look at evidence-based. I hear from my clients that clients struggle to find trainers who are both trained in psychological knowledge and business knowledge, because you need somebody who understands both aspects.
Brilliant. Thank you, Wolfgang. Okay, a couple of more questions from colleagues on the webinar. Do you see any downside risks of combining signing the Time to Change Mental Health Employers Pledge with the Minds Mental Wellbeing Employers Index? Would this be a good way to demonstrate walking the talk?
Basically, I would thoroughly endorse both. So Minds Wellbeing Index it's a very good index, in terms of the kind of questions they ask around really embedding mental health into organisational culture are good, but to be honest, I'd call it more of a mental health index rather than a wellbeing index, because unlike our approach, we really do take that whole person approach. To do with the Time to Change pledge, Employers Pledge, I think that's an excellent starting point for any organisation in terms of actually wherever you are in your journey for a senior signatory to actually make that very public commitment that is underpinned by an action plan. So both are really good.
Great, thanks, Lou. Quite a practical one here. Where can I get a template strategy or policy? So I guess, yes, I want to improve mental health in my workplace. Is there a structure that she could follow?
So first stop, I would go to, this is part of the Heads Together, the Prince's Legacy Project, which is a fantastic portal. Everything's called Mental Health at Work. But if you actually Google Mental Health at Work, Heads Together, Mind, you'll find it. It's got a really good searchable engine in that. But also I would signpost you to Business in the Community and Public Health England's Mental Health Toolkit for Employers. It's really comprehensive, it's digital, and you can find it really easily online.
Great, thank you. And the last question we've got actually from colleagues on the webinar is, a company is not going to forego its financial targets to accommodate mental health and well-being, and hence work-life balance is not a priority for senior leaders. How can that be genuinely addressed?
Well, it's a very interesting one, and I think it can be genuinely addressed by looking at the evidence. We do know that organizations that have high levels of psychological safety, expressed by people being able to bring their whole selves to work, to make suggestions as to how to improve workflow. So it's not a fluffy concept, it's a concept of investing yourself into the job that you are doing, have a much higher productivity than organizations that have low psychological safety. So that's evidence number one. Evidence number two is, and you will find that when you Google it, there's a number of research studies out there that suggest that people in a long working hour culture at some stage have declining productivity. So there's a cutoff point. That cutoff point, of course, is a little bit personal, but overall, again, the direction of journey is very well evidenced in the literature that people need a work-life balance. And as I said before, I don't like that word, because work-life balance suggests it has to be 50-50 or it has to be a certain quantity. What you need to look at is just to give your people the opportunity to be successful at work and successful in their personal life. And that will be different at different stages of your career. At some stage, as an unmarried person without children, you might want to focus more energy into your work to develop your career. Then you reach middle age and you might be part of the sandwich generation and you have parents and children to look after, or even grandparents and parents, which I call the club sandwich generation. And you will have to shift.
You're making me hungry now.
To tip the balance in a slightly different way. But the two key goals are to be able to work and able to love. And that is a qualitative aspect of it. And last but not least, just reinforce the message of psychological safety that we are more successful when we feel safe at work.
Thank you very much. Okay, a final question from me, if I may. I loved what you said when you were talking through the recommendations, Lou. You know, you don't manage what you don't measure.
Yeah.
I think that's what you said. I've got that round the right way.
It was to do with public reporting. What gets measured gets managed.
So how do you measure mental health?
Oh gosh, I'm afraid it's really complicated. I can't possibly answer that. I'm going to pass that on to Wolfgang.
A couple of quick remarks then, if I may. You have more data than you think you have. You have your PMI data, you have your absence data, where you collect absence. Some companies don't. You have productivity data, you have EAP data, you have group income protection insurance data or long-term disability data. If you cross-reference all these data sets, you get fantastic information, and it's not rocket science. But also, in terms of evidence-based practice, we want to be able to measure whether our interventions actually were successful. So there are ways of doing that in terms of ROI, return on investment, but also there are ways of doing it in terms of clinical effectiveness. And I was involved in putting CORE, it's a good measurement tool, into the EAP and then into the NHS practice. But last but not least, you can find a cumulative figure to report on as well in your annual figures. And when you have a good mental health pathway in place, I can rattle off a few figures for you just from top of my head. I have seen companies find that they had a reduction of 10% of claims concerning mental health, a reduction of 16% in the average cost of claims, an improvement of 60% of therapy outcomes, a reduction of 40% of absence associated with mental health. So there is stuff that can be done quite easily. You don't need to have necessarily a consultant to help you with all of that. If you just compare, for instance, the average length of absence before you have done anything with mental health in the past, if you have those figures and compare them to the average length of absence associated with mental health after you have started working on it, you see a fascinating difference.
Amazing. Thank you, Wolfgang. Well, huge thanks to you both in terms of your time. Thank you, everybody, for making some time to listen to these important findings from the Time to Take Ownership report. We've got a lot to do. There are some hints of improvement in some areas, but there's still a lot more we can do to help mental health at work. So, finally, on behalf of business in the community, we are the responsible business movement. More collaboration can happen when we work better together, share what we're good at, and help us achieve our responsible business aims. So please support the calls to action. As Lou said at the beginning, we are recording the webinar and we'll be sharing the URL in a follow-up note and also directing you to the full report, which we really highly recommend that you read. Thank you and have a lovely weekend.
Thank you all.
Thank you.